Day 27 of Learning Exercise Therapy. Which illness is characterized by bronchial hyperirritability that is triggered by a number of stimuli resulting in narrowing of the air passages? Answer: asthma. The treatment plan for a patient with hemiplegia includes reinforcing normal movement through key points of control and avoiding all reflex movement patterns and associated reactions. This approach most closely resembles answer Bobath technique. Which statement concerning the APGAR newborn assessment is not true? Answer: the maximum score is 5. The ratio of chest compressions to breaths during 2-man cardiopulmonary resuscitation is answer 15:2. The most appropriate standard position for bronchial drainage to the posterior basal segment of the lower lobe is answer patient lying in prone with a 20-inch elevation at the foot of the bed. A patient with cardiac diseases rates the intensity of exercise as 12 using Bodge's original rate of perceived exertion scale. A rating of 12 on the perceived exertion scale will correspond to approximately %% of the patient's age adjusted maximum heart rate. Answer: 60. A therapist positions a patient in preparation for postural drainage activities. Which of the following lung segments will not require the foot of the bed to be elevated? Answer: anterior segments of the upper lobes. A physical therapist examines a patient with multiple sclerosis. The therapist documents that the patient presents with Dysdiadochokinesia. Which objective finding is most representative of Dysdiadochokinesia? Answer: inability to perform rapid alternating movements. Which of the following developmental milestone is usually not observed when examining a 4-month-old infant? Answer: transverse blocks from one hand to the other. The intermittent use of tone-reducing lower extremity bivalve casting for children with cerebral palsy hypothesizes that casting may answer inhibit the use of extensor